This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing natural remedies to treat hip dysplasia at home. Hello guys, welcome again back to my channel. This is part 2 of my video series on hip dysplasia. In this section of the video, I wanted to show you 5 specific things that you could look at doing for treating your dog or helping your dog if they've been diagnosed with hip dysplasia or you suspect they have some hip arthritis. So in particular, we're focusing on the hip joints. And I'm also just looking at, specific remedies that I think are probably most important. There's a number of different ones for arthritis, and I've covered similar things in many different videos, but I wanted to give you specific things that will help your dog with hip dysplasia. So if your dog has hip arthritis, you suspect they have hip dysplasia, first of all, I suggest that you've taken your dog to your veterinarian, you had an x-ray, you've got this confirmed. But assuming that's happened, here are some of the natural remedies you can consider using. So the first big thing is just some of the touch therapy and some of the hands-on touch that can be very therapeutic and beneficial. Easy thing to start out with: passive range of motion and massage. Good girl Pippi, who's a bit ranged out, I need to take her for a little bit of a run after this. So as you can see here, I've got girl Pippi. Let's move you on the side. Go girl, you just stay there. Go girl. Is I'm just gently supporting, so Pippi's lying on her right side, so I've got her left leg up here. Girl Pippi, I'm just going to show some range of motion exercises. So I've got my right hand over the back of her pelvis, my left hand just underneath her knee, and I'm just going to sort of flex, I'm going to extend and flex that hip joint. We still want it to move, we want it to produce joint fluid. And just a small motion. We don't want your dog being comfortable while you're doing it. We want you to sort of flex and extend it, because I want you to produce, and while that joint moves, it slowly produces joint fluid. Because we want that leg to still move, and we want to produce that joint fluid. We want it to be less painful. Girl Pippi, let's just show them here, and you're just gently doing it. And it's something where I suggest you can try it twice a day, do it for a week, see if it's helping your dog. The next part of that sort of touch therapy is doing some specific massage techniques. But what we're focusing on is those big muscles that are, supporting that hip joint. So we're focusing on the big gluteal, the big bum muscles back here. Stay here, Pippi. Here, you chew on that. That'll help you. So you see the back of Pippi's leg here. This is her big glute or bum muscles all along in here. About Pippi. Then we've got the muscles along the back of the leg. Think of that as the hamstring muscles, semimembranosus, semitendinosus muscles. These big muscle bellies, the back of your leg, that join up to your pelvis and your glutes. And then think the rest, there's a series of 4 muscles called the quadriceps along the front of the hip joint. Those are the 3 big areas to focus on. Go girl, Pippi. So what we're wanting to do is look at doing that twice a day, where you're going to start out with just kind of this soft effleurage, just warm those muscle bellies up. Running over top of the hip joint, running your hands down towards the tip of her feet. You're trying to move out any lactic acid, any of those cell toxins. We want the blood system, we want the lymphatic system to carry those toxins out, move that stuff out. We also want to warm up those sort of sore, tender muscles, because they're sort of working extra, trying to stabilize that hip joint. So you get them warmed up. You can then look at doing some other type of surface massage technique, such as this one called tapotement, where you're sort of almost looking like you're drumming on top of that joint. So go along the top of the hip, the glute muscles, girl Pippi, along her quadricep muscles, on the outside especially. Try to get on the top of that femur, along the back and along the hamstrings. We're just loosening everything up. Good girl Pippi, you stay there. And then I want you to sort of use your thumb, your forefinger, and then really kind of, you can start here right along the back, beside the hip itself, all along those gluteal muscles. And you can use both hands to speed it up at the same time. And then sort of rub, so the back of this back of the hamstring, I'm rubbing here along her girl Pippi. Pippi. So I'm rubbing the back of her hamstring. Good girl, you're all ranged out, and I'm running along the top of your femur, those quadricep muscles. Good girl, you stay, Pippi. But you're just using your thumb and your forefinger, massaging, feeling for any lumps or bumps. Because what you're actually trying to do is see if you can feel any knots. So first of all, we're just kind of loosening up those muscles. We want to increase blood flow. We want those muscles to be more effective to keep that joint more stable. But part of the issue with hip dysplasia is we need those muscles to be as strong, as effective as possible to keep that joint solid. So then that can come from massage. And if you find an area that's very painful, such as a knot, you actually sometimes feel a particular knot, the muscle's really tight. I'm not feeling anything here in Pippi. You can find that. You can press down with your thumb, your forefinger, and index finger. Hold that for 30 to 60 seconds and then release. Because often in doing that, you can actually, help increase blood flow to that sort of knot or that muscle that's in spasm. It'll take away some of those muscle toxins and ultimately get those muscle fibers moving normally again, and getting that whole muscle belly working much better again. And often, if you've ever had, a muscle spasm yourself, if I get many in my legs, sometimes my back, sometimes just going to see an RMT, having a therapeutic massage can make all the difference. So often that can be really beneficial and helpful. So just don't discount the first big thing, the benefits of it. The next thing is acupressure, and I wanted to show you 2 acupressure points in particular. And they're the ones that are most important for our dogs that have hip dysplasia. So we've got Pippi lying on her side here. Girl Pippi, here. I'm actually gonna sit her on my leg so it's a little easier to see. So here's her left leg hanging down. Pippi, just stay there, girl. This leg along here, this is her femur. And if you run your hand along her femur, girl Pippi. Right here at the top of the femur, you feel this little point of the bone sticking out. That's the point of the femur. So that's almost at the end of the femur. Underneath that lies that ball, or the head of the femur. So on either side of the point of the femur, there's a depression in the bone. And if you move the leg back and forth, you can sort of almost feel that bone close over your back finger or open up in your back finger. So the depression in the front is called the GB29 point. The depression in the back is called the GB30 point. And what you want to do is indent the skin there, which I'm doing here in Pippi, holding that for 30 to 60 seconds, enough that it indents the skin but doesn't hurt her. And you want to do that and as you're doing it, sometimes you can also see your dog they're going to relax into that. And it seems to be calming Pippi a little bit, which is helping for the video. You want to hold that for 30 to 60 seconds because this is a type of Chinese medicine and we're dealing with energy flow. And we know it's not moving the way it should be because of hip dysplasia. Do it for 30 to 60 seconds. Do it twice a day. Do it for a couple weeks to see if it's helping or not. Be surprised how many dogs respond to it. It's such a really easy thing to do. So that GB29, GB30 points. Next few things I want to discuss are things that I've discussed in the past for arthritis, but need to be reinforced. So the first big thing is the use of an essential fatty acids. You can use it either in the form of fish oil or flax oil. Flax oil is far less expensive. It seems to be equally effective. But the big point is you need to be using enough. So we're looking at doses of 1,000 milligrams per 10 pounds of body weight. And if a dog has obvious pain and discomfort, they've got hip dysplasia, look at doing that twice a day. So for something like this, which is flax oil, it's a tablespoon per 40 pounds of body weight. So I'd be giving Pippi 1 tablespoon, but I would be giving that twice daily. Pretty high doses. But fortunately, it's very safe and can really only benefit your dog. In some cases, it takes about 8 weeks to see if there's a benefit or not. And generally, it's just good for her overall health. So I'd advise if any of you have a dog that's arthritic, especially has hip dysplasia, get them on an essential fatty acid, a high enough dose, do it twice daily, and give it at least 8 weeks before you're going to judge whether it's being beneficial or not. Every dog that has arthritis, in my opinion, should be on a glucosamine chondroitin supplement in particular, ideally one in combination with MSM. It doesn't need to be my supplement, Ultimate Canine, but my supplement does have therapeutic levels of glucosamine, which is 100 milligrams per 10 pounds of body weight daily. So maybe we'd be getting 500 milligrams of glucosamine. 50 milligrams per 10 pounds body weight daily of chondroitin. So Pippi would be getting 250 milligrams of chondroitin, plus 100 milligrams per 10 pounds body weight daily of MSM. So Pippi would be getting another 500 milligrams of MSM. And those levels are in combination in my supplement, Ultimate Canine Health Formula. There's two herbs I want to discuss. The first one here is boswellia, and these two in particular are most important for the pain that comes from the inflammation of arthritis, but in particular of hip dysplasia. So this one here is boswellia. It's known colloquially as the name frankincense. We're looking at a boswellia dose. We're looking at a dose of about 50 milligrams per 10 pounds of body weight daily. So something like Pippi here, these are 330 milligram tablets. She's about 40 pounds. I would be giving her one of these tablets a day. And I wouldn't be surprised if I give it to Pippi, she'll consume it. It's actually in a liquid formation, boswellia. One study I'd read actually had shown that when they were combining curcumin in combination with boswellia for arthritis, it was equally as effective as a number of the different non-steroidal anti-inflammatory drugs. So let's try your boswellia here, Pippi. Oh, good girl. As you can see, it'd be pretty easy to treat Pippi with boswellia. Good girl. And then the last herb I want to discuss is the use of curcumin, which I've discussed for a variety of different things. But as I just referenced earlier, that one study was combining curcumin in combination with boswellia, finding it to be as effective as a whole variety of some of the non-steroidal anti-inflammatory drugs. When you're looking at, so here's curcumin here. You want to make sure you're giving it as a capsule formation. As I said, everything does get stained orange, so it's nice and convenient in a capsule. You can get it as, these 400 milligram capsules, and that would be Pippi's dose. Because we're looking at doses of 100 milligrams per 10 pounds of body weight daily. Pippi being about 40 or 50 pounds should be getting about this 400 milligrams, 400 to 500 milligrams, which can be completely fine. And I would start her out as the curcumin in combination with the boswellia. I would start those out once daily, as well as adding in the flax oil, the essential fatty acid. And as I said earlier, just make sure that you're giving it as a capsule, because I've got lots of orange in my house. My wife's not necessarily so happy about that, as I have like curcumin and a variety of powders that have sort of stained some of our cupboards. Very well, Pippi, there's your curcumin. I want to make sure you eat that and don't get that on the carpet. The other thing I wanted to mention is the use of CBD oil, which I've discussed. I've done a video on it, which I'm sure Pippi would scarf up here. So we know that CBD is the non-psychoactive, really beneficial part of the cannabis plant. Come here, Pippi, come up here. Go, girl, come here, you. Yeah, you're thinking it's more food for you. And it has shown some pretty great results for our dogs that have arthritis. Really, this is going to vary based on where you live and if you're even in a state where you can get it. If you can, great, consider it. But no, Pippi, I know you want to eat it. Especially for our dogs that have, especially they're pretty painful. And it may be that you have your dog on a non-steroidal drug, such as Remedies, etc. And you're looking, is there another alternative that I could try? Maybe I've tried the supplements. Maybe I'm doing some massage. I'm doing some acupressure. I'd like to try something else. Consider CBD as an option, especially in these advanced cases. The big thing with using CBD oil, Pippi sit, is you need to be giving therapeutic doses. We're looking at 10 milligrams per 10 pounds of body weight, and that can easily be given twice daily. So just make sure you look at the dose. So for instance, and if you're looking at the amount of THC, you want to have it about a ratio of about 10 to 1. So 10 parts CBD, 1 part THC. So the dog CBD oil dose is 1 to 2 milligrams per 10 pounds of body weight, given once or twice daily. So something like Pippi, she was on the low dose, she'd be getting about 5 milligrams of CBD oil twice daily. The higher dose, 10 milligrams of CBD oil, and that'd be given up to twice daily. So something like this, this one here, the CBD, THC, and we're looking, as I said earlier, we're looking at the dose range of 10 to 1, 10 parts CBD to 1 part THC, so very low THC. just enough to provide some pain relief. This one has about 20 milligrams of CBD oil per ml. Pippi needs 5, so she needs about a quarter of a ml. So it's a teeny amount. This would last you a long, long time. You know, she'd need a quarter of a ml once or twice daily. Thank you for watching this edition of Veterinary Secrets. What I want you to do now is first click down there to like this video. Click up there to subscribe to my channel. Then lastly, go ahead, click that link in the box below. Then I can send you my free books and videos on how to heal your dogs at home with my top natural remedies.